Madam Chair, members of the board, today I will provide another update on the federal government shutdown as part of our ongoing updates on the budget pressures facing the county. This is our third presentation on the shutdown, and while there are few signs of a resolution to the deadlock in DC, there is some good news here in California. Yesterday, the state confirmed that they would bridge CalWORKs benefits through the month of November. As of Friday, when this presentation posted, we expected these benefits to run out in October, so this is a welcome reprieve. The state is also bridging county administrative subsidies for both the CalWORKs and CalFresh programs, ensuring that our DPSS staff will remain on the job and continue to operate both programs during the shutdown through November. That said, we are a mere 10 days from a benefits cliff for nearly 1 million county households who rely on CalFresh to feed themselves and their families. During today's presentation, we will first update your board and the public on our advocacy efforts in DC to avoid a continued shutdown, as well as our work with the state to address any gap in benefits. We will then focus on what we're doing locally to prepare for any gap in benefits, including a discussion of the network of supports and partnerships already in place, contingency planning for the month of November and beyond should the shutdown persist that long, and our plan for keeping the public informed to further limit the damage done by the shutdown. So I'll be joined today by a couple members of the CEO team to make the initial presentation. Angela Ovalle, Acting Branch Manager, CEO Legislative Affairs and Intergovernmental Relations, and Dr. Carrie Miller, Branch Manager for the CEO Policy Implementation and Alignment Branch. We have department heads and departmental representatives who are also on hand in case the board has any questions for them after the presentation. Please bring up the next slide, and I will turn the floor over to Angela Ovalle to kick off the presentation.
Thank you, Joe, and good morning, supervisors. Today marks day 21 of the shutdown, and as of tomorrow will be the second longest shutdown in history. The House of Representatives remains in recess, and on Friday, Speaker Johnson announced that he was designating this week as a district work period, meaning no votes or House hearings are expected to be held during this time. The Senate's 11th vote on the House-passed continuing resolution failed on Monday with a vote of 50 to 43, and the Senate is scheduled to meet again today, but Senator Majority Leader John Thune has acknowledged that a longer-term stopgap spending bill may be necessary if the Senate cannot pass the current continuing resolution. Democrats and Republicans have not formally negotiated on the CR, and Democrats continue to advocate that a renewal of ACA subsidies, which expire on December 31st, be part of the negotiations to reopen the government. Now, a new development is that Republican leaders are quietly talking with senior members and White House staff officials over how to possibly structure and advance an extension of the ACA subsidies before the end of the year. And we are continuing to work with the departments to analyze any proposals that come forward. October 31st is the date to watch, as a number of additional federal programs will run out of funding, including WIC, which was funded through the end of the month with diverted funds. States have been advised that November SNAP payments are unlikely if the shutdown continues past October 27th. And LAIR is preparing a letter to the Secretary of Agriculture and Congress requesting the expenditure of any remaining contingency funds for SNAP, along with additional resources required to fully support participants. And we've also asked our National Association of Counties to do a similar effort. In an effort to put pressure on Democrats to end the government shutdown, the Senate is expected to vote this week on legislation that would enable payment for certain essential federal workers that are required to work during the shutdown. However, Democrats are not expected to support this bill. The administration had planned last week on Friday to announce additional cuts or elimination of some federal programs, but those announcements were delayed due to pending lawsuits. As Joe mentioned, we are in communication with the state and our state associations over the weekend to discuss the upcoming lapse in SNAP benefits, and he shared those details with you in his opening remarks. Yesterday, Governor Newsom said that if the shutdown does not end before the end of this week, CalFresh benefits will likely be delayed into November, for November, I should say. And he also noted that some state-funded food benefit, such as the California Food Assistance Program, which provides food assistance excuse me, for non-citizens who do not qualify for CalFresh, would also be impacted. And in DC, we continue to work with our national association as well as our congressional leaders to advance for the government to reopen. Thank you. Next slide, please.
So supervisors, last week Supervisor Barger had asked, when are the hammers falling on these programs? So this is our hammer slide. What we're representing here is, in a pictorial way, the benefits, the programs that are at risk and when they end. We've laid out the primary safety net programs we discussed last week. This includes CalFresh, CalWorks, Section 8 housing, and public housing maintenance. As I mentioned at the top of the presentation, this slide is already out of date since when it was posted on Friday, based on the news that we shared about the state stepping in to bridge CalWorks benefits and cover county administrative costs for both CalWorks and CalFresh for another month. So each bar shows how long funding lasts before it runs out, as indicated by the red vertical line, and includes the monthly funding amount. The bars in green are administrative costs, with losses hitting the county budget and our staff. The bars in blue are benefits going directly to residents, with losses hitting our communities in ways that will indirectly impact the county budget by increasing unmet needs for food and for housing. Given the state's support to bridge funding gaps, the second two bars from the top, representing CalFresh administrative costs and CalWorks benefits, will be pushed out one more month to the end of November. So that is the change to the slide that was not reflected when we posted it on Friday. This announcement means an additional $112 million in funding will be made available for CalWorks benefits and another $48 million to support CalFresh admin for the month of November. The State Department of Social Services intends to notify counties of additional updates if the shutdown drags on beyond November, as the state continues to refine its cash balances and look at options to help the counties bridge these benefits. DPSS previously reported that they had enough cash to cover CalWorks admin through December 31st, so that information at the bottom of the slide did not change. So based on these changes, our focus right now is on the top bar. This is the $320 million monthly CalFresh benefits that are still slated to end October 31st without relief from the federal government. And while the state continues to explore options for CalFresh in the event of a prolonged shutdown scenario, the state has made clear that none of the options, none of them, would be available in time to cover all November CalFresh benefits. Nor does the state currently have access to enough general fund dollars to cover more than the $1 billion in statewide benefits for November. So there's two problems here, supervisors. One is the mechanism for using state money to bridge a federal benefit. Right now, it's only federal money going into those benefits. And then the other issue is financial. Where is the money going to come from at the state level? For these reasons, and as Angela mentioned, the governor issued a press release warning recipients yesterday that they will likely face a benefits gap for some part of November should the shutdown continue past the end of the month. And our trigger date is Friday. If we don't find out by Friday that there is some resolution, we know that some part of November benefits will not be paid to recipients. Just another point of news, the California Welfare Directors Agency also indicated they have received several inquiries from counties about the feasibility of locally backfilling CalFresh benefits, and I know we had a discussion on this during the first presentation on the shutdown. The agency confirmed there is no available, I'm sorry, they're an association, not an agency. The association confirmed there is no available reimbursement mechanism for counties who choose to issue benefits payments either directly or through funding to outside organizations, and they warned counties that they would be assuming significant general fund exposure if they decide to advance payments, which is what we discussed in our first presentation. Supervisors, I want to flag one more risk, and we flagged it before, but I don't want to lose sight of it. While we're focused today on the immediate risks due to the shutdown, we can't lose sight of the additional pressures that will come to bear as H.R. 1, the so-called big bill, is implemented. We haven't touched on this in the past few presentations, but it is still a huge risk. And as we've said in earlier budget updates, the precise impacts of the big bill will not be clear until the rules and regulations of implementation are established by the Department of Housing and Urban Development, the Centers for Medicare and Medicaid Services, and other agencies tasked with making the bill a reality. So at this point, I'm going to turn the floor over to Carrie Miller, who's going to discuss what we're doing locally to plan for a benefits gap in November.
Thank you. Next slide, please. So as you heard, our first priority is about the loss of CalFresh benefits, and with that, trying to figure out how best to provide food to our residents. As you can see on the left slide, the need is really great. We have about 980,000 LA County households who rely on CalFresh now, which translates to about 1.5 million children and adults that rely on this program to buy groceries. They only have 10 days of grocery money left between now and whenever the government reopens. One of the things that we're looking at is what are our existing resources in terms of supporting these families. And one of the advantages we have is a very strong network of food pantries and local CBOs and partners. We have more than 600 partners with 940 sites across LA County that are all coordinated with the LA Regional Food Bank. The county and our partners have a number of existing programs that are offering resources right now as we speak with residents who are facing food insecurity, which is outlined on the slide. I won't walk through all of these resources now, but as you can see that the majority of these links are supporting food and folks who are food insecure. However, we also included supports that affect rent, mortgage, and housing supports because we know that people, once they lose this CalFresh benefit, may need to start spending more of their money on these other types of services as well. Next slide, please. So as part of our contingency planning, we've been working very closely with a number of our county departments and other partners in the community to figure out what are actions we can take now to help mitigate the impacts of these delays and try to increase or address the increasing demand that we are anticipating in the month of November. So we've been talking to a number of folks, and one of the key strategies that we're recommending for the board's consideration is to increase the capacity of our food pantries by allocating an additional $10 million in funding to help them meet this anticipated surge of food requests. This would allow us to not only provide additional food, but it would allow us to add additional sites, drive-through sites, and make it people to access the food that they need within their own communities. Our inquiries so far to partners who work in the food insecurity fields across county departments as well as our community partners is that the $10 million initial investment is the right starting point for where we are. This was the strategy that we took during COVID-19. Our first initial strategy was to invest $10 million with our local food pantries, and then we increased that amount accordingly as needed as the pandemic continued. What that funding allowed us to do back in COVID was to provide additional donations of food to as many as 550,000 residents, which included 10 to 12 meals per resident, at an additional 500 sites, and this funding and support lasted for 8 weeks. And it included 15 county-sponsored food distributions that served thousands of people at each one. Many of those were up to 3,500, and there was one site that actually served up to 7,000 people in a single day. We also are having positive discussions with our managed care plans about supporting food distribution, and we are hopeful that they will partner with us in increasing the food supply as well, and we will continue those conversations. This slide also notes that if this shutdown continues beyond December, that we have other options that we can explore, including expanding grocery vouchers, looking at grants to EBT vendors, and also looking at expanding our emergency rent relief programs. These potential actions could be implemented as part of a longer-term strategy that focuses on significant increases to food distribution and housing supports, which we know both are critical components of our safety net that is very likely to become at risk if this shutdown continues beyond December. Next slide, please. And so what we are doing now is we are working with our partners on a messaging campaign, both to those who may be food insecure, but also to folks who are interested in helping to donate and help those folks in need. So we have a two-part communication strategy right now that's being led by the Department of Public Social Services. Part one includes efforts to notify recipients that their CalFresh benefits will be impacted and sharing information about where to go if they need food assistance. The second part is a call to action for our public seeking their help in increasing donations of food and other critical supports to our local CBOs and other providers. DPSS has launched a text and email campaign already that has allowed their recipients to know that this is coming, and they started that campaign last Thursday. The messaging will be amplified through social media posts, and the posts that are being offered are in 5 languages that include English, Spanish, Korean, Mandarin, and Armenian. We also are working with DPSS, DCBA, and DEO on trying to leverage our network of EBT grocers to also get information out at point of sale to either A, let folks know that these delays are coming, but also to let folks know if they're interested in donating, where to do that and how to provide those donations. Our countywide communications team has created a social media toolkit that urges residents to find help if they are in need, as well as encourage people to donate and support these folks. We are also looking at giving a Give Early campaign to those who already are primed to give food and donations during Thanksgiving and the Christmas, winter holidays time period, because they're already willing to do this. So what we're going to do is ask people to give early, because we know that the need is going to be coming early this year. And I do want to say that the social media toolkits are being shared as we speak and are starting to go out. We also want to make sure to share that the campaign that we're doing around communications is aligned with the state, and we're staying closely aligned with them to make sure that our message is mirroring the timing and effect of what they're sharing as well. And with that, I will turn this back to Joe.
Supervisors, let me conclude the presentation with a discussion of our immediate next steps. Carrie mentioned the recommended investment of $10 million in the regional food bank to support a surge in food distribution at local sites. If by Friday this week the federal shutdown remains unresolved, then residents will for sure see a gap in their November food benefits. I mentioned that earlier in the presentation. The Department of Public Health has an existing contract with the regional food bank. If that day comes and goes, we will work with the department to increase that contract by $10 million on an emergency basis. It's a very similar model to what we did during COVID, as Carrie mentioned, so we have a good playbook we can borrow from. And then at a later time, we will return to your board with a recommended source of the $10 million that we would add back to the DPH budget to cover the emergency contracting needs. And that would likely take place in your board's regular mid-year adjustment in February. The last point I'll make is this. Carrie talked about how we are reaching out to all of the folks in this space who provide food or otherwise support diapers and pet food or whatever it is for people who need some additional help. I see this as an all-county, all partners moment, all hands on deck. This is not something that the county can shoulder alone, given the magnitude of the cuts. And I'm concerned that our partners aren't as concerned as we are. So we've been ringing the alarm bell for the last 2 weeks. And as Carrie mentioned, we've had some positive conversations over the last few days as people start to realize that this is looking more and more likely to happen. And so we're hopeful that in the next 2, 3, 4 days, we'll have other partners step up, including the health plans, philanthropy, and others who we've been talking to, just to add some more capacity to the system during that benefits gap. And I'll conclude my presentation there. We should be on the question slide. Thank you.
All right, thank you for that, and thank you for the work that you're doing, Carrie, to put this all together. Supervisor Mitchell.
Thank you very much, Madam Chair, and I agree. Thank you for
ringing the alarm bell, which we have done through these standing items, and really being very public and direct and upfront about what the general public's going to face, and hopefully getting the attention of our partners. As you mentioned, literally ringing the alarm bell and helping people hear. I got a text from a community college president in my district who heard the clarion call and is talking about how he's going to partner with private entity to provide 5 meals a week to every student on campus. So I want to use that as an example to reach out to other community colleges to figure out what resources they have. A couple quick questions for me, Madam Chair. Again, the mechanism issue. In your walk around yesterday, Joey talked about it, and I'm stuck on that because I thought there was a mechanism, and I'm not sure if it was the state or the county that would use it, when CalFresh benefits were lost through fraud. There was a way that benefits could be, uploaded to their card. I don't know how immediate, but there was a way in which people were made whole. I never assumed that that was the federal government that took that action. So I just want to continue to push back on the lack of mechanism assertion. So can you help me? Can someone help me understand if there's a difference?
Supervisor Michael Sylvester, Chief Deputy Administration for DPSS. The fraud fulfillment on a fraud transaction is a request and I'm sorry. Your particular question about fraud and reimbursement to the card versus where we are
Yes.
Today.
Yes, because I'm hearing that the state says that we don't have a mechanism, that because the resources come directly from the federal government, that there is no way in which the state or county could add benefits to a card, if we were to magically find the money. So that's the piece that I'm confused about.
So the fraud restoration actually does run right back through the same channel. It goes back through the federal processor, FIS, who actually provides it today, and it's on a request and receive basis.
Got it. Okay.
So that's slightly different.
So it is, okay, I never understood that it was the feds that did that directly. I want to make sure I understand the good news, and I hope you'll update that chart, because I'd like to be able to share that chart with my constituents. And so the good news, the relief that we got from the state was on admin costs only, not benefits, correct? So if we can go back to that chart.
Yeah, can we bring up the slide so we can look at it? I think it's slide 3.
So the one line, the admin line, will extend to November, but the beneficiaries, the $320 per month cash benefits to recipients still ends October. Is that correct?
Right, so the first bar from the top, the cash benefits to recipients under CalFresh, that ends in October. The next 2 bars below it, county administrative costs for CalFresh and benefits for CalWorks, those are pushed out another month. So one benefit program gets us an additional month, and that's why we focus today on the CalFresh benefits.
On the food element. Excellent. Another question to Lair. There are 2 safety net funds at the state. There's the safety net reserve account, all done through budget work. Then there's the child and family, I don't remember the name, which was the sub-account used to help increase CalWorks benefits annually over the last several years. I know the safety net reserve was drawn down in the 24-25 budget year to keep from cutting into the programs as it was designed to do. My question is, are there any resources in either of those 2 accounts that could be tapped at an emergency basis? The safety net reserve was designed for CalWorks and Medi-Cal specifically, but the legislature could opine if we were to use it for CalFresh. I don't know if there's any money left in that account. That's one question. But the sub-account that's been used over years to increase the CalWorks benefit probably has some money in it. Is that something that the state is considering, or if we should ask them to?
Yes, we will ask them. As of now, they have not indicated that they're going in that direction, but we will reach out to DOF today.
And I will give you in 2 seconds the name of the first sub-account that I can remember. That I know is an ongoing fund because, again, it's been tapped to increase CalWORK's benefit on an annual basis since 2017 or thereabouts. So hopefully there's some resources there that could be tapped into. Thank you very much for the presentation. Thank you, Madam Chair.